Tea and coffee is a big thing. What about alcohol? So I find a lot of my clients are regular wine drinkers.
Patients who drink a lot, they don't realise how much sugar is in the alcohol that they're having.
Does mouthwashing change the microbiome?
It's very difficult to try and just go after the bad bacteria.
Drinking water with lemon in it to help with weight loss. There's absolutely no evidence behind that. There's no way it's going to help with weight loss. But people are doing it. So what's the alternative? Would vodka with Diet Coke be a better option?
Apple cider vinegar,
Yeah.
lemon water, fruit juices, etc., etc. They're all acidic.
Now, D has become a blanket deficiency in this country. Do you see vitamin D deficiency when you're looking at tea?
Initiated behaviour. Because if they're used to having that chocolate at an early age, it becomes a habit.
Yeah, absolutely, yeah.
And you sort of get addicted to it. But how would one increase one's metabolism to become leaner?
Welcome to the Dietitian Bites podcast with me, your host, Reshma Patel. I'm a registered dietitian and personal performance coach. I'm also the founder of the Dietitian in Harrods, providing private nutrition and coaching services worldwide. I'm passionate about optimizing health and mindset for success. Each episode is packed with practical tips, expert insights, and a healthy dose of fun. Join me on this journey towards a healthier and happier life. Dr. Nilesh Parmer is a distinguished dentist with a wealth of expertise and a genuine passion for his craft. His journey has been nothing short of inspiring, and he has successfully balanced his time between his thriving 7-surgery practice, specialising in implant dentistry and dental sedation for nervous patients. Dr. Parmer's dedication to providing exceptional care shines through in every aspect of his work. His collection of awards further solidify his reputation as an outstanding professional. Dr. Parmer recognises the importance of continuous learning and self-development as one of the few dentists in the UK to hold degrees from all 3 London dental schools and an executive MBA from Imperial College Business School. And this, for him, is just the tip of his pursuit of excellence. It is with great pleasure and anticipation that I welcome Dr. Nilesh Parmer to the Dietitian Bites podcast. Welcome, Nilesh.
Thank you very much. What an amazing intro.
Yeah, well, I'll be honest with you. It took me a while to cut down your 3-page biography into a paragraph. And I did think to myself, when do you stop? I mean, you do so much.
I think I went through a period of my life where I just did loads and loads and loads. And I have slowed down lately, as much as I think I've slowed down. But stuff just keeps popping up. So you're always trying to better yourself. And I mean, the way I see it is the careers we've chosen, we're going to be doing it for the rest of our lives. So I always wanted to be very, very good. I don't think you could ever say that you're the best at what you do, but you keep working at it and you just fill your time up with stuff. But if you really enjoy what you're doing, it doesn't feel like work. It's actually fun.
Absolutely.
That's why you do stuff like this on a Saturday morning.
And from the clinical perspective, are you still a dentist, like clinically working?
Yeah. So before COVID, I was doing 6 days a week clinical. Now I try and do between 4 and 5 days a week. We're just so busy with patients that just to meet demand, I'm working 4 or 5 days a week. And it's something which I'm trying to cut down on.
Yep.
But all dentists have this problem of not saying no to more work. So I'm working on it.
So are you still working 6 days, or has that?
Clinical work is between 4 to 5, but I'm involved with a few other organisations, and that takes a bit of time off at the weekends. And I'm writing a few things at the moment. So one of my passions, which I think my GCSE English teacher is probably quite surprised about, is actually writing. And I do a lot of that at the weekends. So you could call it work, but it's something that I enjoy.
And when do you get time for your hobbies like driving and racing?
So the racing, again, post-COVID, the racing sort of calmed down a little bit. I didn't think a racetrack, which is probably not the most hygienic of places to be at the best of times, and you've got 300 men who are camping out, racing cars, that's sort of taken a bit of a back burner. But we'll be back onto the racing probably next year. the driving tools, like I've just come back from Switzerland today, the driving tools we still manage to fit in at the weekends or take a week off here and there. So we're still having some fun.
Well, it's amazing. It's amazing that you are successfully doing dentistry and you've got all your practices and managing to somewhat have a life outside of that, doing other things as well. So it's really good. I thought about this long and hard when I thought, what, do I want a dentist on the podcast? And for me, it's really important to have all professionals that ideally work in nutrition to some extent. And as I started my career, I always thought dentists and dietitians don't actually mix as a profession. Yeah. And I thought one of the reasons that is we're all about, don't have the sugar and, have a healthier diet, which in turn means, you'll have better dental health if you're not, sitting there chewing on sweets or having a lollipop in your mouth or things like that. So I thought dentists and dietitians don't really work together, yet our jobs really overlap. And I find now at this point in my career, I'm like, God, dental health is so important and we don't talk about it. So we don't learn about it in nutrition. We learn about everything apart from the teeth, I think. So we do every organ from brain, liver, gut, you name it. We've got something to do with nutrition, but we've never talked about hygiene, teeth, and oral hygiene in any way. How about for dentistry? Do they ever cover nutrition?
The main thing with dentistry is, and I think it depends on the dentist themselves. As you mentioned, sugar for us is one of the main key components in developing tooth decay. Mm-hmm. And nutritional deficiencies in other areas can also affect healing. It can affect the gums, and there's loads of other things that can cause issues for us. But in terms of, do dentists really, really focus on nutrition for their patients? I think it's something that we need to expand on, and something that we do need to work with our colleagues such as yourself to actually get a better understanding of it. Because for us, if you have a half an hour checkup with a patient and we say, you've got tooth decay, do you have a lot of sugar? And the patient will always say, no, I don't. And we just say, okay, brush better, off you go. So we don't have the ability to sort of delve into it. At university, you tend to do diet sheets and you try and record what patients are eating. But A, patients don't fill them in, or B, a lot of my patients probably leave out the odd bit of Twix bar or something. But you tend to do that for children. You don't tend to do that for adults more often. And I think, like you said, it's something that we do need to focus on and work with people such as yourself.
So with children, I guess sugar is the main thing. And them eating, I would assume it's more convenience and fast kind of foods like sweets, chocolates, biscuits. In the adult population, where is the sugar intake predominantly coming from?
It's a really good question. So there's always trends, and it depends where you are. And this is my understanding of it. I've seen teenagers, young adults, who would be absolutely fine and stable, and then all of a sudden they start having decay. And a lot of it comes from energy drinks, is what we found. Okay. It's sort of Red Bull, Monster Energy. And where my clinic is, my window overlooks the road, and I see the kids going to school and going back. They've all got Red Bulls and energy drinks and things. And now they're vaping, which is a totally different problem. But for the purpose of this, they're having sugar, and the amount of sugar in Red Bull, which obviously is huge. And then we find that they also have chocolates and sweets and things throughout the day. So they're snacking on it. They're not having it continuously. If you move on to adults, adults who now, a lot of them work from home. And we find that they're snacking a lot more. They're having lots of cups of tea and coffee. My first question is, how much sugar do you have in your tea and coffee? Oh, I have 3 sugars. Oh, I have 2 sugars. I thought, well, how many cups of tea and coffee do you have? I have 8. That's a lot of sugar to have. Plus you have a biscuit with it. And I mean, I'm all up for a bit of indulgence, but on a daily basis, you'll start to get tooth decay.
Tea and coffee is a big thing. What about alcohol? So I find a lot of my clients are regular wine drinkers. Does that impact their teeth or?
Yeah, so with wine, obviously the sugar content of wine, that can cause problems. So if we step back a little bit, the 3 things I'd look at in terms of oral health would be, number 1, tooth decay, right? So you get holes in the teeth, you get little holes in the teeth, you get a bit of sensitivity, you get a big hole in your tooth, you'll get nerve pain. If it's really bad, you may need root canal treatment, then you may need the tooth removed, then you may need to see an implant surgeon like me to have the tooth replaced. So that's your tooth decay issue. Number 2 is your gums and your gum health. What affects that is deficiencies, vitamin C especially. Alcohol can affect it a lot because the alcohol will dehydrate you. You have less saliva. And in the saliva are lots and lots of compounds which help fight bacteria and gum disease.
Yeah.
And thirdly, it's oral cancer. Now, the oral cancer, again, you're predisposed if you're missing some of the vitamins, C, D, E, A, but also alcohol is a big factor in it. Now, we also find that patients who drink a lot, they don't realize how much sugar is in the alcohol that they're having.
Yeah.
And that becomes a bit of an issue. And plus, if you drink a lot and you're a bit inebriated at the end of the day, probably don't brush your teeth. Right? So the thing with dentistry is it's not only is it what you eat and what you do, but there's also lots of behavioral factors which we need to take into account. So alcohol is a big issue in the older population. But again, you'll find wine, but you'll also find when I go out with my friends, when they say I'll have a vodka and Coke, then my alarm bells go. Like, why are you having Coke? There's loads of things you can have which aren't as bad. So, yeah, it is a big, big factor.
So what's the alternative? Would vodka with Diet Coke be a better option?
So, gin and tonic is probably quite good. Vodka tonic is probably quite good. There's an erosive factor to it. So, whatever you recommend, there'll always be a bad part of it. But if you want to minimize things, vodka tonic, gin and tonic, much better than vodka Coke.
So my clients are never going to give up drinking. I've
No,
already tried that. So I now have to just come back with the best alternatives. And when we do weight management, I'm thinking about gin and slimlines and champagnes. But I would like, to be able to say to them, actually, even from a dental perspective, these are the best options for you. Because it's not just about, ideally, I don't want to look at just people's weight and say, okay, from a weight management perspective, this is the best thing. It's a holistic approach. It's if we can help every part of your lifestyle and your health, then these would be the best options.
And I guess it's being realistic about it as well, isn't it?
Yeah.
I think for me, there's certain absolutes that I have for my patients, which is if you smoke, you'll die sooner. That's my absolute. I say if you smoke, there's a very good likelihood that your life will end sooner than it should do. That's number 1. Number 2, if you smoke more than 20 a day, you can't have dental implants. We won't do that. So that's another absolute. Everything else, I think there's a bit of wiggle room here and there. But my question is, have you seen a lot of patients who are now vaping, and have you seen any issues with them vaping from your side?
I don't have a lot of clients that do vape, only because I think now that where I am, based in Harrods, for starters, if they do, it's unlikely that they actually tell me that, we vape. I know the ones that do smoke, my long-term clients, they haven't actually moved on to vaping. Their option is to smoke or not to smoke. They don't want that interim. They don't get the same hit. And I don't look at anyone in the community anymore, which is where I would find it a lot more. One thing I do see, and I see this with my own children, is supplements. They always want gummies as a supplement, and they can both now swallow supplements. So we went from drops to tablets. We missed the gummy stage, but they love it because all their friends are having gummies at school, and they're like, why can't we just have a gummy for omega-3 or the vitamin D? And my biggest thing is the sugar in them. Because you'll leave my home, you'll have it in your mouth, you'll keep it for as long as you can, and then you've got all this residual sugar.
Exactly. It's a sticky residue which stays, and with children especially, the teeth, the little fissures in the teeth are quite deep. And as dentists, we used to do something known as fissure sealants, where we'd actually put resin in the little fissures, so it stops food getting stuck in them. Some dentists probably still do it, but the issue with the gummies is that sugar will stay in the fissures, and that will lead to tooth decay. And it's something which has been made because kids will have it because they're gummies, and they will get the vitamins from it. Whether or not having the vitamins in that modality is beneficial or not is something you would know as opposed to me. But the actual sugar side of it is something that concerns me. I got sent some gummies, some gym creatine gummy things. And then I had one. I was like, there's a lot of sugar in this. And you turn it over and I think, geez, it's packed, isn't it?
Yeah. When we look at manufacturers and, if they ever want an expert opinion, which they usually do on, what's the maximum dose we need? What else can we get in there? I just feel like the one thing I always say to them is you can't make a product with this much sugar anymore. You just can't do it. And they are replacing it with a lot of sweeteners. But I still think it's not helping a child with that sweet tooth of wanting a sweet. And the reason they're taking it is because they see it as a sweet, which I think worked for years and it was great marketing. But now we need to get serious about the type of supplements we're bringing out for children, especially. How can we stop the kids' teeth rotting with gummies? Could they have it with breakfast and not have it on their way to school?
It's always going to be a compromise with whatever you do. And in terms of the sugar attacks, when you have something sweet, the bacteria, and it's quite a staggering figure. So an adult in 1 milliliter of saliva has 1 billion colony forming units of bacteria.
Wow.
In 1 milliliter. And that can be even greater than that. It can be 10 billion. So every time you have some sugar, these bacteria go mad and they start reproducing and they'll start laying down acids which will dissolve the teeth. But that tends to happen in one chunk. So if you have your gummy, then you have your food. And you have it all in one go, that's better than having the gummy in the morning, then eating something a few hours later, then eating something a few hours later, because that acid attack will happen more often.
Okay.
Because if you can, so we used to say to parents, if you need to give your child sweets, give them the sweets directly after dinner.
Okay.
Because they're already full, so they hopefully won't have too many sweets. I don't have any kids, so I don't know the dynamics of it. Right? I just have a nephew who I spoil. So you'd give them sweets after dinner, and that sugar attack would hopefully be minimized, as opposed to them having dinner and then having a chocolate bar before they go to bed is probably the worst thing.
Okay.
And also when you sleep, the protective influence of your saliva, which has got lots of compounds in it that help fight against bacteria and tooth decay, your salivary flow rate when you sleep, as in the amount of saliva you produce, reduces. So you're more likely to have tooth decay. That's why when kids used to have a bottle with milk and some honey in it or something, they'd get loads of tooth decay.
Yeah, that's where our guidance actually about, dropping the bottle before the age of 1 came about, is because of the dentists and their guidelines of actually the teeth are getting affected. You need to get everyone off. And I guess we have a big role in weaning. So we were like, okay, we can figure this bit out. So that's another great example actually where dentistry and nutrition have come together really well. It's in children more than adults.
Yeah, definitely.
You mentioned vitamin C and vitamin D deficiency. Now, D has become a blanket deficiency in this country. When I graduated, vitamin D deficiency was not a thing in the UK or the US or anywhere like that. It was really, I would say, more of a third world problem. Now, vitamin D deficiency is so predominant that we've just had a guideline change where we are going to tell everyone to take vitamin D supplementation throughout the year. So not just in the winter months. You need a basic dose throughout the year. We haven't actually figured out what the dose is for ethnic and minority groups or those at more risk or vulnerabilities. It will be higher. We just need to know what that dosage is. Do you see vitamin D deficiency when you're looking at teeth? So how would you know?
As a sideline, I do a 3-monthly finger prick blood test to look at my levels of a few things. And as you get older, you start taking a bit more interest in your own health. And I was quite low on vitamin D as well. And then I started taking a spray supplement and it went up a little bit. And then recently, the doctor said I need to have a bit more. So I have to do 2 pumps of the spray. So, why, etc., is another thing. But yeah, you are right. And in terms of patients, it's the manifestation of vitamin D deficiency in the mouth is quite tricky to observe. Because I do a lot of surgical work which involves bone work in the jaws. Sometimes if we've done some work and an extraction site doesn't heal properly, or we place a dental implant and the dental implant fails in an otherwise healthy patient, we do start querying deficiencies. And we've had a few patients where I've sent them off for bloods and they have come back as deficient in a few areas. Vitamin D especially, but also high cholesterol appears to have some form of an effect on bone healing. As a sideline, there's lots of medication. There's a class of drug known as bisphosphonates, which they give to little old ladies who've had arthritis, and that makes our life quite difficult because by its very nature, it affects healing in the bone. So when we're doing surgical work, it can cause issues. Vitamin C deficiency, you used to see it back in the day, but now
It's definitely not one that I've seen.
it's not one that I see very often now.
Yeah.
But D especially, yeah.
So you don't routinely, I guess you wouldn't have to take blood tests for your patients.
No, I think there probably are some clinics in town who, before, as a routine, before patients have dental implants or any surgical work, they would routinely take some bloods. We've not factored that in yet, but sometimes with certain high-risk patients, we may take some blood from them and send that off to the lab to check. But with a lot of our things, the patients want the treatment done quite quickly.
Yep.
No one is very patient when they're missing a front tooth.
I can imagine.
And with dental implant success rates are in the high 90s anyway. As long as they're healthy, they can brush their teeth properly and they don't smoke, 99.8% should work for 10 years minimum.
Okay. What stops it from working, I guess, in that, other health conditions, like you said, high cholesterol, for example, can cause issues with healing. What about metabolic syndrome and diabetes, which would be a big one?
Yeah, it's diabetes.
Okay.
If they have uncontrolled diabetes, then again, we shouldn't really be doing anything to them until they've got it under control.
Yeah.
We also warn patients who are insulin-dependent diabetics that their wound healing could be impaired.
Yeah.
They may get more pain afterwards, and I can't guarantee the longevity of the dental implants. We also find, cholesterol, bisphosphonates, diabetes, smoking, history of periodontal gum disease. We know there's a genetic factor involved in gum disease, and that may also affect the longevity of the implant. So the main thing that we're doing is we're saying to our patients, right, these are the issues that can affect the longevity of this work.
Yeah.
You may still enjoy these teeth or these implants for 10, 15, 20 years. If you're coming to me and you're 65 years old, I don't need to really give you a 30-year guarantee on this work. So we try and assess each patient on their own merits. But generally speaking, the older they get, the more comorbidities they have, and the trickier the work can begin. Because if you go back to low salivary flow rate, if they're on lots of medications, then that's going to affect the salivary flow rate. If they're on bisphosphonate, it's going to affect the bone. If they're smoking or they're vaping, that's going to affect the gums. So there's such a multitude of factors, and a lot of it is behavioral as well. So the fact that we do anything and it works is amazing. But and then sometimes I look at the stuff we've done, and I've got 15 years worth of data now, and I'm on a 97% success rate of dental implants, 3% failure rate. And sometimes it's incredible that this stuff works so well.
Yeah.
But if the patients can brush their teeth properly and everything else is okay, then everything should last. You get the other side note, the anecdotal find is penicillin allergic patients tend to have loads more complications after surgery, tooth removal. They tend to have a higher incidence of dry socket, and they have a higher incidence of early implant failure. Why? We don't know.
It's interesting.
I think it's to do with the oral microflora would be different if they've never been exposed to penicillin, but we really don't know.
So just on that note of oral microflora, we have been doing a lot of work with the gut microbiome now, because we know there's a direct link with the gut and the brain, and trying to work out how we can help clients with IBS to maintain it. And I'm always thinking about the mouth. I'm just so fascinated, and I'm like, we have so much bacteria in there. I mean, I'm sure there's bacteria everywhere else as well, but just in that area, I feel like we've got so much bacteria, because that's where it starts, right? With all the salivary amylase and to break all our food down. Does mouthwashing change the microbiome?
As in
does it remove? Yeah, does it remove?
Yes. So
the
the mouthwashes that the old-fashioned Listerines that used to have a lot of alcohol in them, they used to really burn.
Yep.
They would basically nuke all the bacteria.
So the good and the bad?
The good and the bad. It's carpet bombing for everything. But then what would happen is it's a very short-term issue. The bacteria would come back very, very quickly. Now we've moved on to sort of chlorhexidine mouthwashes. We've moved on to fluoride mouthwashes. And it's very difficult to try and just go after the bad bacteria in the mouth.
Yeah.
You're better off just having good toothbrushing. And the one thing which is quite common in Asian minorities or ethnic minorities is tongue scraping.
Yes.
So the volatile sulfur containing compounds which sit on the tongue, which can cause bad breath, etc., etc. We find that so many of the bacteria in the mouth actually live on the tongue.
Okay.
So tongue scraping is something which I routinely try and introduce into my patients. Not brushing the tongue, because that just moves stuff around.
Yeah.
Actually, tongue scraping. And there's a few companies in the UK that actually make really, really good metal tongue scrapers, sort of old school Indian ones. That use them. So you get really good ones now, and we try and bring that into our patients' oral hygiene regime.
Doesn't feel like it's out there enough in that, we've always got the 2-minute timers on the brush and all the adverts are very much brushing focused. There's nothing on the whole tongue scraping bit.
No, it's not. It's something which is not really caught on in Western society that much.
Also, I think with the way we've got our campaigns for smoking, which is really big, it's full on, they've made some big changes. Dentistry is a massive profession. I mean, huge. How come no one's started a campaign of what actually happens to teeth if you sit and drink Coke, or, just having visuals? And I think we can handle really disgusting visuals after seeing everything that's gone into packaging for cigarettes. From a dental point of view, why has nobody thought, let me make a big campaign and let it go live?
Yeah, it's always been an issue. And I think it comes down to funding. You've had great campaigns for drink driving and great campaigns for smoking, exercise, obesity. But in terms of oral health, there's never really been any campaigns that sort of stick in your mind. And I think perhaps there may be commercial interests involved. I think a lot of the toothpaste companies, they do put a lot of money aside for these sort of campaigns because they always mention it in their adverts. But in terms of a big campaign, no, we've had like National Smile Month or Cancer Awareness Week, etc. But I think a lot of it gets lost in the noise. The main thing we have at the moment is dental tourism and work being done abroad. And and also you get a lot of the dental stuff is cosmetic. So how to whiten your teeth in 20 million ways using things which you would never really use. Right. And I think that has all shone a light on things, but the way dentistry is sort of portrayed in the media is, I couldn't find an NHS dentist for 13 years, so I pulled out my own teeth.
Oh, wow.
That's the sort of stuff that we see. That's what makes the media, as opposed to don't drink Coke because your teeth will fall out.
Well, just, I mean, obviously you couldn't put a picture on a Coke can because I think Coca-Cola would have something to say about that. But I guess from a nutrition point of view, we've had campaigns like, I don't know if you remember Sid the Slug, which was all about,
Never met Sid, unfortunately.
That was for blood pressure and salt. And, he was all about the salt and don't have too much salt. We wanted to reduce blood pressure. We've had weaning campaigns, when to wean your child, and things on nuts, not having nuts in pregnancy, then having them, and allergies. So we've had a lot. Now vitamin D obviously is a massive thing for us. But I just feel like from a dental point of view, I don't really see anything. I guess I'm more aware of it because I have children. And I'm like, you know what? If they just put a picture of rotted teeth, it'd be great. And I've always gone onto YouTube to teach my children, this is actually what happens. This is why it's not good for you. And I'm never going to be the mum that says, don't have sweets or chocolate. I'd never take that away from them. But I do want them to know the impact of having it without having to go to the dentist. Like, it shouldn't be, I went to the dentist and he's told me I can't eat anymore. You should know it beforehand. And now my kids are very much, they're, luckily for me, my son eats no chocolate at all. He doesn't like it. But on the flip side, my daughter loves it. So she will, turn to it, and I will then say, can you have it after a meal, not just as a snack in between, because of my fear of, I don't really want you to ruin your teeth. Is it okay to ruin the first set? Because the second set's going to come through?
Yeah, we get that a lot with patients who say, it's okay, it's only the baby teeth, that's fine. To me, it's to do with initiated behaviour. Because if they're used to having that chocolate at an early age, it becomes a habit.
Yeah, absolutely,
right? And you sort of get addicted to it, right? I'm a self-confessed chocoholic. But as my sister says, I'm almost psychotic in how I eat chocolate, because I'll have that one green and... Can I mention?
Yeah, you can mention
I
names.
can have that one green and black's white chocolate bar will last me about 2 months, because I'll only have like a tiny little piece after dinner. So I really ration it off.
Yeah.
But I think once that behaviour is ingrained in them. It's very difficult to change that behaviour in children. And I don't really see that many kids anymore. When I did see kids, we have a really good bakery next to the dental practice. And
prime location.
And I'd hear patients saying, or parents saying to their kids, if you behave in the dental chair, I'll buy you something from the baker's on the way out. I think, well, so you're rewarding good behaviour with sugary snacks. And potentially that could be a problem. Going back to your first question, is if the deciduous teeth or the baby teeth are lost early, yes, it can cause issues. The main way it causes issues is due with the eruption of the permanent teeth. It can either make them erupt in a funny way or a funny angle or too soon or too late. Or if they get big infections around their baby teeth, it can affect the appearance of the permanent teeth. So that's something to be aware of. So, if they do lose the baby teeth, it's not the end of the world, but we need to look at why they've lost them and how can we make sure that behaviour isn't repeated with the permanent teeth.
So we've got a lot of nutrition trends going around. One that I've seen for years now is drinking water with lemon in it to help with weight loss. There's absolutely no evidence behind that. There's no way it's going to help with weight loss. But people are doing it, and the only impact they're having is their teeth. So they've got lemon squeezed in or quite acidic waters. And my concern is I don't know what's happening to the enamel of your teeth, but I'm sure you're going to get some sensitive teeth. What's the impact of having trends like this?
So apple cider vinegar, lemon water, fruit juices, etc., they're all acidic. Right? So what happens is that pH level will wear down some of the enamel. And if it wears down the enamel sufficiently, the enamel can break a bit more, becomes weaker. Teeth can look yellow because the dentine which sits underneath the enamel starts to shine through, so teeth look yellower. It's very difficult to hide that. And also you'll find that the teeth can start to chip off. If they also have a vomiting disorder, then that can make things even worse. And it's quite common, you see on the inside surfaces of the top teeth, they'll look yellow. They almost look like somebody's come and carved them a little bit. And that's very difficult for us to fix. It's a really awkward area to lose tooth tissue. And long term, that can cause serious complications. Sipping, if you're having the water and you're having it in one go, then it's okay. Like we said before, you have the bad things in one hit. But if they're, and you get those lovely jars that you see on Instagram and TikTok where they fill it with loads of different colourful fruits and it looks very nice. And then you'll see these influencers walking around sipping on the water throughout the day. Then you're having that acid attack continuously on the teeth. You'll start to lose enamel and tooth tissue. And you see it on certain patients because it's the tips of the teeth start to look very translucent. And that's when we need to start looking at crowns or bonding or behavioural changes. But it is difficult to treat.
So that takes us nicely on to the next question of eating disorders. Do dentists in general see clients with eating disorders?
Yeah, you would see, one of the key things is, like I said, if patients are vomiting a lot, then you will see saucer-shaped lesions of erosion on the palatal surface of the top teeth and the inside surfaces. And also on the back molars, you'll see it as well. But for us, if you imagine you have a half an hour, 45-minute appointment, it's you've got so many other things to check as well. It's quite difficult to zero in on that one thing. And with a lot of them, they'll be avoidant. So I've had patients where I've said, you've got a lot of acid wear on your teeth. Why do you think that is? And a lot of them will say, I had a gut condition or stomach condition. It used to make me vomit a lot, but it doesn't happen anymore. It's all in the past. So then either do you pry into it more with this stranger who you've just met into something which is quite a sensitive issue? Or do you talk to them about the risks associated with it? Or do you say to them, right, use a fluoride mouth rinse, use a fluoride toothpaste, don't brush or scrub too hard, and I'll see you in 6 months. If you can build a rapport with your patient after a few years, then yes, you can go down that line. And we have had those difficult conversations with patients in the past. One thing is to try and liaise with the GPs, but it is inherently difficult. They're so busy to try and get a GP on the phone. And in the end, you'll end up writing a letter, and then you sort of say to the GP, right, we've seen signs of this. can you please speak to this patient about it? But it becomes very difficult to deal with it.
100%. I think it gets lost in translation. And this is where the care for a patient is so divided in so many aspects. Because when I see eating disordered patients, it's usually when the disorder's there for maybe 2, 3, 4 years. And I always think to myself, how many professionals have you seen that have probably missed it? Because one, we're not looking out for it. And I guess from a dentist's point of view, it might be really difficult to say this person has disordered eating. After I had my first, I remember going to the dentist and he was blown away by my teeth. He was like, wow, what have you been up to in the last year? And I said, I've been vomiting every single day, numerous times a day. And it's usually not been food. I've just vomited acid. And he said, oh, it's really taken a toll. He goes, can you have anything hot or cold? I said, no, I can't have anything. So he picked it up straight away. But I also think he must have known I'm here for that 1 year check. I'm post-pregnancy. If you have a woman just lying there and you see that, it's really hard to have that conversation and then to flag it to the GP and actually open up that system for that patient where actually we're here to help and we see the impact of it. A lot of people with eating disorders don't really care about the impact of their teeth. They've not thought about it. It's not on their, I can't tell them, you're going to lose all your teeth if you keep doing this. They don't really care. The psychological impact's so great on them that they're not really bothered. And I guess now with all the treatments of, they're like, oh, well, we can fix that. It's not the end of the world because there's so much that you can do to help. But I think it's a really big thing. And it's almost, I say, would junior dentists be able to pick up on disordered eating and eating disorders when there's so much pressure for them to just get that treatment right and, tick all the boxes?
Yeah, it's tricky. I think when it's severe, you should see it straight away.
Okay.
Sometimes you can pick it out when the patient walks into the room.
Yeah.
Because you'll see their stature.
You'll see, this is it. Can you notice the other signs and then put 3 things together to say, I need to make a referral?
But again, I think, and this is common amongst all healthcare professionals, that many of them are stressed. They've got other things going on in their lives. They may not enjoy their job very much.
Yeah.
To them, we've all seen the advert where the patient walks into the room, the dentist or the doctor is there writing, the patient sits down and then they look up. I always try and bring them from the waiting room myself so I can see how they're sitting, what are they wearing, how do they walk, what is, with ladies especially, if they're very frail and very gaunt, and they're 25, 27-year-old and they're very, very slim, you have to start asking some questions. And that's where diet comes in. But then for me, in the last few years, after trying to become more of a well-rounded person and not a very black and white clinical person, is I actually enjoy having long conversations with my patients now and sitting down and saying to them, how are you?
Yeah.
So what's happening in your life? And you'll be surprised how they open up to the healthcare practitioners. And they'll say to you that this has happened or this trauma has happened, etc. And then the more you delve into it, you get so much information back to them, which is beneficial to us as to what do they need from us or what can we do. Sometimes they've come to you for, okay, they've got a hole in their tooth.
Yeah.
But they might have also come to you for other reasons as well. And I find, especially with a lot of the older patients, they've come to you because they also want to have a chat.
Yeah.
And when you give them that opportunity to chat, they're off.
Yeah, they can open up and tell you what's going on.
And it's amazing how they open up. And I've had patients where they've been telling me things and I'm getting upset because I'm like, wow, all this has happened to you in the last year? I can't believe it.
Yeah.
And then sometimes I think, right, come back and see me in a month. Not because I need to check your teeth, because I want to check on you and see how you're doing.
Yeah.
And I think we forget about that you're trying to treat the whole patient, not just the mouth or whatever speciality you're part of. And for me, that's something that I think a lot of healthcare practitioners are beginning to lose because we're so stressed with so much else that's going on.
Yeah, I think it is really difficult for me. Eating disorders is a really tough space to work in. I'm now seeing a lot of younger children, from 13, 12 onwards in clinic. And it is amazing that when you sit there and you're listening to their story and you ask them, how do you feel about drinking hot and cold drinks? And how, and they're like, it's painful, it hurts. And I'm like, have you addressed it? Have you seen a dentist about it? And they're like, no, because at 12 or 13, you're not going to know what professionals you need to see. And that's, for me, it's like, okay, you need to, I'll just tell the parent, I'm not going to make a referral, but I'll tell the parent that you really need to get a dental checkup done because the impact is far and wide. It's a lot. So I guess from a dental point of view, like you said, if you can recognize that that person, doesn't 100% look okay, they don't look well, they look a bit malnourished or tired or lethargic. And bad breath is another really common symptom. They're living in a state of ketogenesis, essentially. They're not having anything. There's a lot of muscle wastage going on. They present quite well if you know what you're looking for. If you don't know what you're looking for, it's really difficult. And again, I think here's another gap where we need certain professionals, dentists being one of them, to be on board to say, actually, we've just recognized this and we're going to flag it with the GP. It's still a difficult conversation for the GP to have. What are they going to do? Phone up the patient and be like, okay, we need to see you. It is really difficult. But I think just to have that open conversation, if you did think that person was, suffering with any sort of eating disorder, the chances of them self-harming and doing things like that are really high as well. So in my clinic, when I'm weighing the girls, I'm always like, look, is it okay if you take your top off, just so we get a really accurate weight? And when they're doing things like that, I am, jumpers and things, I'm looking at their arms thinking, okay, can I see anything? Do I need to take this one step further? And I think that's just me being a bit more holistic. So it's not my job to, sit there scanning everyone. But I am thinking this is really important, because if you look at all these cases of essentially child abuse that have happened, a lot of professions have been brought into the question. It's like, oh, you saw this person. What were you doing when you saw this person? And you probably be like, well, I was just here to look at their teeth. I wasn't looking at anything else. But we miss the obvious signs sometimes.
Yeah, so true. And it's something which has flagged up a lot recently, especially in the press with certain children. And I think you are. Something looking at the hands is something that I've started doing now, especially with older patients. I'm looking for bruises. Do they bleed quite easily? And I've noticed that with certain patients, you can see that arthritis is beginning to take hold.
Yeah.
And then you're saying, right, are you using an electric toothbrush or a manual toothbrush? Can you floss? Because once you start to get the flossing, it becomes very, very difficult. So then they can use things like water picks or ultrasonic toothbrushes to try and help them. And like you said, and on a few occasions, you do see some scars here and there, which are a little bit concerning. And then you have a conversation with the patient. And for me, it's how well do you know the patient? Because as you know, I've got some patients I've been seeing for 10, 15 years.
Yeah.
And for those patients, I feel quite comfortable to say, look, what is this?
Yeah.
Tell me what's going on. And it's almost like there's a missing professional in the line.
Yeah.
And that missing professional person is almost a counselor or a therapist.
Yeah.
Which I think, so if I see a patient who's got an eating disorder or is self-harming, I can refer it to the GP. But in my head, I'm thinking, I think they just need to talk to someone. I think they just need professional help. And I think that's something where we, in the NHS, we don't have enough funding for that. The whole counselling issue isn't there. And I think more so than ever before, the population as a whole, everybody needs a bit of help with something. Everybody needs to talk about something to someone. And we've been so diluted with social media that the ability to have that one-on-one conversation with someone has kind of gone. And it's that missing professional that I think we need.
So when I first started my career, it wasn't obviously sitting in Harrods. It was in the community and doing home visits. And I worked in malnutrition. And I remember thinking to myself one day, why are the dentists not being picked up on poor practice with patients? And that's the only thing that went through my mind, that this is an actual dental problem. My client got malnourished because no one fixed their teeth. And we see it in elderly patients. They're not eating, not because they've lost their appetite or they don't like the food. They physically cannot eat it because they've lost teeth or really poor dental health. But this poor person can't actually get out. And the wait list for a dentist to see them at home is so long that they'll probably disappear before they actually get that appointment. So for me, I think, again, you need to work with all the professionals put together to say the actual problem with this person is that they don't have teeth. Or when people used to get admitted to hospital and we couldn't feed them because they left their dentures at home. So they can't actually eat. And a soft diet in hospital is not that great. Everything's just blended and mushed together. Is malnutrition predominantly something dentists work on and work with?
I mean, I remember doing, we call it domiciliary visits, actually going. And it is very difficult to do because you don't have any of your equipment. You try and take as much with you as you can. But you almost have, in one surgery, you have £100,000 worth of equipment.
Yep.
And all I could take is what my nurse and I could fit into a bag. Plus, there's lots of CQC issues and registrational
Yes.
issues and controlled substances, and it's a real minefield. But I always used to say that if I ever won the Euro Millions, I'd open up a huge clinic on Harley Street, and anyone over the age of 70 would get free treatment for everything. Because when you look at NHS exemptions for dentistry,
Yep.
if you're pregnant, you get free treatment. You could be fit and healthy, making 100 grand a year, you get free treatment. You had a baby in the last 12 months, you still get free dental treatment. You could be worth £2 million, you still get free treatment. If you're a child, you get free treatment. But if you're over 70, 75, if you fought in the war, if you did this or have all these other ailments, if you're bedbound, you don't get free treatment unless you're on job seekers or income support, etc. And I always thought that was we were really not looking after our older population in that stance. Now, the other issue you have is making dentures, which is what a lot of these patients you're talking about need, is becoming a lost art, right? So, number one, the technicians who are good at making dentures are all slowly retiring. The younger technicians are not as interested in making dentures, nor are the younger dentists, because that's not the sexy part of dentistry. And we are finding loads and loads of patients who come to us to have dentures made because they can't find anyone else to do it. Now, the way I always explain dentures to patients is I say, if you lose your foot or you lose your arm, when the doctor gives you a fake prosthetic version, do you think you could still pick things up with such ease? Or if you had fake legs, could you still run 100 meters in the same time? No, you can't. If you've got fake teeth, i.e. dentures, do you think you can still eat that medium rare steak before? No, you can't. So your food choice is going to be limited no matter what, especially full dentures.
Yeah, which is what a lot of our clients actually have.
Yeah, and they're very difficult to make. It's very difficult to meet patients' expectations, and it's a disability. And what we give them is aiming to improve on the disability, but it will never be perfect. The only way to make it as good as your own teeth is to have dental implants. So that involves surgery. But the main issue isn't the surgery. The main issue is usually the cost.
Absolutely.
There's no government funding, marginal government funding for dental implant production or insertion in elderly patients in the UK. And if you ask an elderly patient, you're going to have to come up with 40, 50 grand to have your teeth done. And if they don't have it, they just can't have it done. So that's why that malnutrition issue is there. So one of the key things is, focus on the kids and the young adults now, so that when they're older, they do have their teeth. And try and make the existing adults as comfortable as possible. But if they can't come to the dental practice, it does become very difficult. We find that the elderly in care homes, some care homes are very good, and some care homes, it's difficult to organise them coming. If you imagine dentists, NHS has got a 2-year waiting list anyway. How do you organise that? It's very, very difficult. We don't have that bracket of individual is almost being unsurpassed because we don't have the funding for it.
We also see, clients lose a lot of weight as you get older, naturally muscle mass and everything changes. So even these perfectly done dentures no longer fit.
Correct.
And, they're literally falling out. I can see them just when my clients are laughing, I just see the denture fall. Oh my God.
And they
poor
break
people.
and they snap.
Yeah.
And the other interesting thing is the dentures themselves, the acrylic dentures, will harbour bacteria. So the bacteria will go into the plastic, live within the pores in the plastic. And no matter how much Sterident or bleach you use, you'll never be able to fully disinfect the denture. And then we found, so actually one of my master's research projects was looking at the prevalence of MRSA on dentures. And in one hospital, we found 11% of dentures in hospital inpatients were contaminated with MRSA.
Wow. So this bacteria is literally everywhere.
Pretty much, yeah, especially in hospital.
How do your teeth impact mental health? But when I say mental health, I'm talking about disease states like dementia and Alzheimer's. Is there a link?
It's a really good question. The honest answer is I don't know. I think in terms of anything which will affect your mental status can affect the teeth by the very instance that you may not be able to brush them. properly.
Yeah.
If the ability of self-care starts to diminish, the ability of that person to look after their teeth goes.
Yeah.
If they start eating or chewing on things which they shouldn't be, then they can start damaging their teeth.
Yeah.
If they start, there's a lot of self-harm which actually happens in the mouth, which is where patients can be chewing on things which they shouldn't be and cause damage and laceration, especially to the lips and to the corners of the mouth. So yes, it can affect it, but there's so many variables. It's such a behavioral issue as well. But the main thing that all dentists sort of the default position is, please brush your teeth twice a day, etc. Use fluoride toothpaste. We haven't gone on to the vegan bit, which is an interesting topic. But for us, if you do have somebody with, if you are looking after somebody with dementia, we do find that the oral health can diminish because they may not like you going near their teeth. You may have to brush for them. And that's something that should be quite uncomfortable. There's be a lot of trust involved in doing that. And that can be quite time consuming as well.
So vegan diets are on a rise for many, many reasons. And, you know, I do support them, obviously, for an ethical reason. But for me, from a health perspective, anyone that wants to be vegan should really see a dietitian just to have that once over of these are the things you will be deficient in. And there are nutrients that you'll 100% become deficient in. So we just want to make sure that you've got the knowledge, you know how to bridge that gap and then safely continue on a vegan diet. However, I did one of my research projects was on postmenopausal women and their risk of fracture and osteoporosis. And these were all women that were having dairy. And it was shocking because I think, you know, 1 in 2 women postmenopausal will suffer with osteoporosis. And I was thinking, well, if your bones are getting brittle and things, and you're all eating dairy and calcium, what's happening now to the population? And I haven't obviously checked what's happening to their actual bone health and if vegans are more likely to have osteoporosis, but what's going to happen to their dental health if you're completely removing calcium from your diet from a dairy perspective?
So it's such an interesting subject. And having a few good friends who are vegan, it's something which we've become a bit more enlightened to previously. Now, there's pros and there's cons from a dentist perspective. The pros is, generally, if you're a good vegan, you're plant-based. You're having lots of polyphenols, you're having lots of colour on your plate, etc. So if it's done well, it's a good, balanced diet. Right. The downside, and there's 2 things which I think can affect the downside, which you've already hit on, is nutritional deficiencies. Calcium, especially. Now, the good thing about the jawbones is the jawbones don't seem to be as affected by osteoporosis as much as the long bones. Right. So the osteoclastic activity isn't as exaggerated in the jawbones as it is in other bones, because it's all mainly it's basal bone up to a certain extent. It can affect the jaw joints potentially. But in terms of the jawbones, luckily, it doesn't tend to cause too much issue. It's the medication that's given for it that can affect the jawbones. Having said that, the other issue is, and I've noticed that a lot of people who are more holistic about their health, who are going down the vegan, the vegetarian route, a lot of them tend to think that having mercury or amalgam fillings can be bad for them, and they'd like to get that removed. So, as you know, my father is a dentist. I've seen fillings that he did 40 years ago. And there's only 2 types of fillings that have lasted that long. Right? One's gold crowns and one's amalgam fillings. Never, ever, and I'll stake my career on it, will a white filling last for 40 years. Because it's plastic. The material just isn't wear resistant enough for it. And that doesn't mean they're bad restorations. It just means they need more upkeep. They need more work. Now, the patients want those amalgam fillings removed and then have white fillings put on because they've become all holistic. They can get more problems. Right, especially if they're deep fillings. The reason why amalgam works so well is because it rusts around the corners. Now, the other issue is, and the bigger issue is those who shun away fluoride toothpastes. Right? Now, London tap water, I believe, is fluoridated to zero point 0.7 parts per million or
Yep.
something, right? But the biggest development in dental health
Yeah.
was fluoridating tap water and fluoride toothpaste.
Yeah.
It makes such a difference to resisting tooth decay, to
Yeah.
stabilizing bacteria in the mouth, that patients who don't use fluoride toothpaste, you can usually spot them a mile off because they've got loads of holes in their teeth, or
Yep.
they've got early enamel lesions that we see on x-rays. So coming from the vegan side of things, if you eat well, you're aware of the possible nutritional deficiencies,
Yep.
you've spoken to someone like you,
Yeah.
and they use fluoride toothpaste, then it's fine. Crack on. No problems.
The thing is that trends change so quickly, and I say so quickly, but you have the short-lived ones that are a year or two and then they disappear. But we were a nation of cereal eaters at one point. Everyone ate cereal, and now people don't. And for all the right reasons, I would say we don't, because we know that they're not always the best and the healthiest, and there's alternatives out there, and it's high in sugar, low in fiber. However, we fortified the cereals with things like, vitamins and minerals because we knew the whole population was eating them. So a lot of people are going to get it. Like fluoride toothpaste and water, for example, people don't drink tap water. They have these new filtered systems put into their homes. And a lot of people that I know are still on bottled water. So they're not wanting to drink any tap water. And again, they're missing out on the fluoride there. And the other trends are all these, black charcoal or whatever you call it, activated charcoal toothpaste. They're not going to have fluoride in them at the right level.
No, and those ones are the ones that will actually wear the enamel down because they're very abrasive.
Yeah.
And yeah, you are right. And I never thought about the actual implications of having filtered water, so the Brita filters and all that sort of stuff. And also in terms of the, so many people don't drink, I'm quite happily drink tap water for me. But you are right, lots. And especially I would summarize the people who come to see you in Harrods probably aren't drinking tap water either.
Certainly not.
It's probably Voss or Fiji or something.
They're drinking water, but they're now drinking water with fruit in them as well. And, that's a big thing because, again, the acidity and, having a pineapple in there, chunks of pineapple, I don't know if that's the best way of doing it. Also, a lot of my clients are smoothie drinkers and, blending their fruits in the morning. So for me, from a fiber perspective, I'm always like, don't do that. Try and have something whole. Don't blend everything. You'll get to a point in your life where you might need to have blended food. Don't start now. But again, the impact of continuously drinking a smoothie over an hour, and I will tell some of my clients that take an hour or take 20 minutes to drink it. But that's 20 minutes of you sitting there playing with sugars, just floating around in your mouth. There will be an impact on your dental health.
Yeah.
So it is tough. Well, Nilesh, I can't let you go without talking to you about business. Dentistry is a saturated profession in my eyes. There's so many dentists out there doing amazing work. How do you stand out in your profession?
I think for me, it's quite easy because most of my work is implant based.
Yeah.
There's only, we think, 2,000 dental implant surgeons in the UK. So most implant surgeons are quite busy. There's not many dentists doing implant surgery. In terms of the cosmetic dentist, so what the abundance is of is Invisalign, tooth whitening, bonding.
Yeah.
Many dentists have gone down that route, and many are amazing clinicians who do fantastic work. How do you differentiate yourself?
Yeah.
And for me, it's social media presence, being kind and good to your patients, not hurting them, and giving them, the way I always looked at it is when I first qualified, loads of dental practices had websites. So you had like Smile Dental or Parmar Dental, etc. But no one really marketed the dentists themselves because dentists were a bit shy. So the first thing I started to do was market myself. So I had a website with my name.
Yep.
Because for me, I was like, when I see my optician or my hairdresser or whatever, I see the person. I don't care where they work. I see the person because I trust the person. And I thought the same thing should apply to dentistry. So you get that loyalty when you start building your individual branding. And once you develop your individual branding, patients won't say you need to go to Smile Dental because they're really good. They'll say you need to see Reshma, or you need to see Nilesh.
Yeah.
So that was something that makes you stand out a bit more. But you do have to put yourself out there.
Yeah.
And in this day and age, when you put yourself out there, that can have pros and it can have cons to it. The other thing was having a great team, having good staff, good feedback, and as with all things, just being good at what you do and working on it. Just understanding that you will never be the best. You can just be better than you were yesterday.
Do you enjoy that part of your career, actually managing people?
Yeah, I do. I find it quite rewarding. We've got a great team.
Yeah.
There's always that kind of relationships. And in dentistry, I have, so let's say across two clinical sites, I think we have 30 to 40 members of staff, I think.
Yeah.
And 90% are female. So you're surrounded by lovely women every day.
And I can see why you love your job.
and managing women and managing men are two different things.
Are women harder?
No, I don't think so. I think women you have to think about a little bit more, but without coming across as chauvinistic or anything. I have to be very careful what I say. I think the loyalty you'll get from a woman, in terms of if you're fair to her, if you listen to her, if you understand what she needs from the job, and you treat them with respect at all times, doesn't matter who it is. Getting loyalty from them, I think, is a bit easier than men. Men who can be a bit more career driven, who can be a bit more cutthroat potentially. Don't get me wrong, women can be like that too. But I find some of my most loyal staff who've been with us for 14, 15 years, my own nurse, who I always joke is going to work with me until I retire, are some of the most loyal people I've ever had the pleasure of working with.
And who taught you business?
So as you know, my dad is a dentist. I learned a lot from him. He was always save, invest. From a very young age, he had me reading the Daily Telegraph and the Financial Times when I was a kid. So I was reading this huge magazine. But also, I think recently, where I think my career started going in the direction I really wanted was once I finished my MBA, actually. That was, I think, one of the hardest, because it was so much work. And it was also one of the most rewarding things I've ever done. Once I did my MBA, I managed to do 3 full seasons in a race car with sponsorship from loads of dental companies. It helped me set up my healthcare consultancy during lockdown. And in everything I do, I pull things that I learned from, and it wasn't just what you learn while you're on the course, it's what you learn when you talk to people outside of the course. And it just helped me think about things in a completely different way. Because as healthcare professionals, we're very black and white and stuff. Right? And people are not black and white. People have many shades of grey. So managing people. So what we basically do on a day-to-day basis is, okay, the actual work is the easy part. Is managing the human being behind the body or behind the teeth, which is a tricky bit. And I think one of my favourite modules on the MBA was the negotiation part, and also the marketing part. But it kind of helped me understand individuals a lot better, is to figure out what their why is. Why have they come to see me? What is it that they want? So if they come to see me and they say, my front tooth is loose, or my front tooth sorted out, but I'm saying, Anu, you got a hole back here. I'm not treating their why. So if I concentrate on the back tooth, that patient won't come back. I need to concentrate on what's bothering them the most, sort that problem out first, and then deal with everything else. Even if that isn't the ideal way of doing it, you can't always stick by the book. And I think that sort of thought process has helped me in not only professional relationships, but in personal relationships, and just dealing with anyone I meet. So to everyone who's listening, if you're ever on the fence about doing an MBA, please consider it, because for me, it was one of the best things I ever did.
Lovely. Well, I definitely won't be doing an MBA anytime soon.
I don't think you have time.
I don't think I have the will anymore. I thought I'd do a PhD, and that's still on the table for one day. But MBA, I think I'll give that one a miss for now.
Did sell it well enough.
No, you've definitely sold it. I mean, your credentials sell it all. But for me, I think I'll learn business on the job is how I've seen it. Before we end, Nilesh, I'd love to give you the opportunity to ask me any questions so our listeners can get to know me a bit better as well.
So one of the things that I started reading was, or watching, was Tim Cook, I think it was. And one thing I've started doing is I used to have cereal for breakfast every
Yep.
day. And I'm quite embarrassed to say, but I will say is ever since I was a kid,
Yeah.
my dad and mum always just give me Rice Krispies
Yeah.
in the morning.
Yeah.
And
I mean, I think we've all grown up on something like
but
that.
the problem was I kept having it throughout my entire childhood and also into adulthood. So I'd always have Rice Krispies in the morning. And I went from full fat milk to skimmed milk and all
Yep.
that stuff. And now I just have a banana and an espresso for
Yep.
breakfast. So as a dietitian, do you think that people should not be having breakfast anymore? Should we, because breakfast was always the most important meal of the day and it was always
Absolutely.
drummed into us. So as adults who want to be healthy and be fit,
Yep.
should we be having breakfast or should we have that fasting period between dinner and breakfast?
So the fasting period can be any point. It could be that you start at lunch, or it could actually be you start at breakfast and you finish, 3 o'clock in the afternoon. A lot of research suggests that intermittent fasting of some sort is good for us. As a dietitian, I don't do it. I don't intermittent fast because it doesn't work for my lifestyle. So I think about food the minute I wake up. And then as soon as I come home in the evening, I'm still thinking about food because that's me, decompressing, winding down. So it doesn't work for my lifestyle. I don't know if it would work for dentists per se, because you need the energy to start the day. You need something to start the day. You may not have time to have that break in between. You may have a meeting, you might have an emergency, you may have to return a call. So your lunch hour is not necessarily always a protected lunch hour. So for me, I don't think it works for a lot of the professionals that I work with. Intermittent fasting doesn't work. They're training in the morning. So I wouldn't recommend it as my go-to for healthy. I wouldn't do it because it's healthy.
And eating later. So I find that, so if you go to India,
Yeah.
I know that a lot of the individuals have dinner quite late.
Yeah.
10 o'clock
Yeah.
restaurant booking is quite normal.
Yep.
And then you'd eat quite a big meal and then go to sleep.
Yep.
Is that something, so that period between finishing the meal and then sleeping, should there be a couple of hours between it, or does sleeping straight after, is it bad for us? Does it make us store more fat? What's the issue there?
So we don't actually store more fat. And this, people always worry about eating carbs late at night. And I'm like, what is your actual fear about eating carbs late at night? And they're like, oh, but it's not going to burn. I was like, it's going to burn exactly the same way. It doesn't slow down. It doesn't have a change. Ideally, you'd give yourself 3 hours to allow for that digestion to happen. Also, food can impact our hormones. So a lot of people, when they have such a heavy stomach, can't sleep well at night. They feel like they've got sleep disturbances. So that's a common thing in the evening. But from a metabolism point of view, I wouldn't say that, eating late at night is going to, you make anyone fatter? It won't. But people might wake up in the morning not feeling like they want to have breakfast because they haven't actually digested the food overnight. Once we go to bed, I guess digestion is one of the processes that really slows down because your brain is, dumping all the material out, and any repair that needs to happen will probably happen when our bodies are flattened, when we're asleep. So digestion is not top of your list. So I imagine that people that eat quite late at night would then feel like, oh, I don't really feel like having, a full fry up in the morning because you're still digesting the food. I don't think it's an issue. Ideally, if it disturbs your sleep, don't do it. Drinking is a massive issue if people are doing it late at night because it 100% does disturb sleep.
So if I could ask you one more question.
Go for it.
I think the holy grail for a lot of young adults, or not young adults, older adults, would be increasing their metabolism.
Yes.
Now, is there any way that you recommend to your patients to say, right, okay, you want to burn more fat, you want to become lean, because the look now is, instead of being, especially for men, instead of being muscly, the look is now the leaner look, right?
Yeah.
And personally, I've had that from a lot of friends who say, especially my mother, who doesn't like me putting on muscle, I get told off at 41. They all prefer the leaner look.
Yeah.
So how would one increase one's metabolism to become leaner? Is there a magic ingredient, some amazing herb that I can have?
No, Nilesh, there's nothing. Otherwise, we'd put it on NHS prescriptions for everyone. This is a question I get asked all the time. Women come to me a lot because they say, oh, my metabolism's really slow. And I'm like, that's not a thing. That's not actually scientifically a thing. You don't slow down your metabolism. Metabolism changes. And you know how we talk about the basal metabolic rate? What are the basic level of calories that you'd need at rest? The more muscle you have, which is a active tissue, essentially, the more you have, the more you can eat because you need to fuel that. So if people want really good metabolism, my answer is go to the gym, actually lift weights, work out, and you'll see that your BMR starts to go up and you can eat more and more food. What happens with females in particular is as we go through the menopause, we have a shift in our fat and muscle mass. And that's what we say, I guess that's what it means by metabolism slowing down. It's not it's slowing down, it's you're having more fat than you are muscle because of the change in hormones. For men, I get it that now it is a lot leaner, and men that I see in my clinic, they don't want to bulk out. And I always say to them, you don't have to do exercise. I'm not telling you to do deadlifts and things like that to bulk out. Essentially, when you have a progressive load with weights, you're starting to build the muscle. You can still do really good resistance training, strength-based training without building lots and lots of muscle. And it's a great place to be for the first time because now we're seeing that men aren't using steroids and they're not using everything else to bulk out. And they're not heavily wanting to eat meat to do that. Because initially, when I first started, men really were reluctant to be plant-based because they were like, no, I don't want to lose my muscle mass and my tone. Whereas now I find they are plant-based because they want that leaner look and they want to be, I guess I call them upside down triangles where they're really top heavy. And I'm like, what happened to the bottom half? You didn't work it out. That's how you work your metabolism. It's actually in the gym. It's not even in the kitchen. I tell people abs are technically made in the kitchen, but your metabolism works out in the gym.
So I'll be off to the gym after this.
Off to the gym. Try not to get into trouble with your mum. Nilesh, it's been an absolute honour to have you. It's so vital for professionals to sit together to discuss just a roadmap of what we could do to work together potentially. And I would love to see more dentists have a specialist interest in nutrition. We see a lot in doctors. So a lot of my friends have a specialist interest in nutrition. You see that they're actual GPs, but they do so much for the nutrition population and in the world of nutrition. And it's so impactful because I guess the word doctor means so much to people and patients, and rightly so. It's a position of trust. And if a doctor was to give the best nutrition advice, I think it would make our lives so much more easier because they've heard it twice or 3 times because they see their doctors. And for me, doctors are, your traditional GPs, but also the dentists, and I would love to see dentists, create some magic in nutrition.
Definitely try.
So Nilesh, where can our listeners find you?
So my dental clinics are in Essex.
Yep.
I also work in London. If you just type my name into Google, it'll all come up.
Yep.
So just type in dentist Nilesh Parmer, it will be there.
Thank you. Thank you so much for your time. It's an honour to speak to you.
My pleasure. Thank you for having me. It's been great fun.
Thank you for tuning in to the Dietitian Bites podcast. I hope you found the information we shared today valuable. To stay up to date with the latest episodes, please hit the subscribe button or follow so you never miss an episode. And if you have any comments or suggestions, I'd love to hear from you. For more personalised guidance on your health and nutrition journey, don't hesitate to book in a 30-minute consultation with me through my website, thedietitian.com. And for daily inspiration and tips, follow me on social media, The Dietitian Global. Thanks again for listening in, and we'll see you next time on the Dietitian Bites podcast.